This week, according to the Maryland Department of Health, Howard County became the first Maryland jurisdiction to reach 70% of all residents fully vaccinated. Additionally, 83% of our eligible residents, that's those who are 12 years of age and older, are fully vaccinated, and 88% of our eligible residents have received at least their first dose. This progress would not be possible without each of our residents who actively engage with their family, friends, neighbors, and loved ones, provided information, offered rides, or took care of young children so that family members could get vaccinated. To all of our residents who have rolled up their sleeves and gotten their vaccine, thank you. Since shots became widely available this spring, we've considerably scaled up our vaccine efforts. There are clinics available every day at locations around the county. You can walk into any pharmacy and most urgent care sites and doctor's offices to get vaccinated. With the recent uptick of COVID-19 cases and the spreading of the Delta variant, it's become abundantly clear how important it is to get your shot. If you haven't already, now is the time. It breaks my heart to know that we continue to have preventable deaths because a person didn't get their vaccine. Please continue to urge your family, your friends, all who you care about, take your shot. As the virus has evolved and more studies are completed on the efficacy of the vaccines, we know there are still many questions from our community about what's next. Currently, any resident who is moderately or severely immunocompromised can schedule their third dose of Moderna or Pfizer vaccines. And Dr. Rossman will talk a little bit more about eligibility. For the general population, I want to be clear. Booster shots have not yet been authorized by the FDA, but will be recommended many months after your second dose. These shots are intended to boost the effectiveness of the Moderna or the Pfizer vaccine, which may decrease over time. We know that many of our older adults and our seniors, who were some of the first to receive their vaccine, are feeling anxious and unsure. We anticipate that booster shots will begin to be available by the end of this month or early October, but we are waiting for final approval by the FDA. Howard County has led the state in our vaccination efforts throughout this year, and we have the infrastructure in place to handle third doses and booster shots throughout the fall and the winter. There is an abundance of vaccine supply, and right now, the very best thing we can do is to be prepared. Locate and keep your vaccine card safe and ready, or request your records as listed on the board next to me at md.myir.net. For those in our community who still need to get vaccinated, please don't hesitate. The Delta variant is widely transmissible, and your best protection against serious illness or death is to get vaccinated as soon as possible. Throughout this pandemic, our team has worked to be as clear and transparent as possible. And as more details are made available, we will continue to share that information with our community. We will beat COVID-19 together, and we will all ensure that not only are you empowered and educated, but you are part of the team to make sure that others stay informed. Thank you very much.
We understand that there are lots of questions about the differences between COVID third shots and booster shots. Simply put, the third dose is an extra shot in the COVID vaccination series meant for those with compromised immune systems. The booster shot, which has not yet been authorized by the FDA, is intended to boost the effectiveness of the vaccine after a certain period of time has passed. The FDA and CDC recently authorized the third COVID shot of the Pfizer or Moderna vaccines for individuals with compromised immune systems. This shot is necessary as some immunocompromised people don't build the same level of immunity after vaccination that others do, and they may benefit from an additional dose to ensure protection against COVID-19. People should talk to their medical providers about their medical conditions and whether or not an additional dose is appropriate for them. If the third dose is recommended, you can reach out to the health department, local pharmacies, retail stores, and your medical provider to get your third shot at least 28 days after your last COVID vaccine, either Pfizer or Moderna. Back to the booster shots. Booster shots, which as County Executive Ball mentioned, have yet to be authorized by the FDA and CDC. We are waiting to hear if they will be indicated for the general population or select groups who have received either the Pfizer or Moderna series of the vaccine. While we expect authorization may come within this month, details regarding the spacing between initial doses and whom will be eligible is not yet known. While we wait for authorization and guidance, the health department is already planning for booster clinics. Our clinics will be available by appointment for those eligible, starting at the specified timing between shots. Currently, we are hearing an 8-month period since your second shot. So you would be eligible on your COVID vaccine 8-month anniversary. Unlike the early days of COVID, there is plenty of vaccine available, again, at a variety of locations, including our local pharmacies, supermarkets, big box stores, provider offices, and local health departments. You can choose the most convenient and easiest method for you to obtain your vaccine. For those who have yet to get their initial COVID vaccination, we strongly urge you to consider doing so. The Delta variant, which is now the dominant strain in Howard County and around the state, is highly contagious. Getting the vaccine now is your best protection against severe illness and death from the virus. It keeps us all from missing work, school, staying out of the hospital, and missing other very important events in our lives. Thank you.
Good morning. It's a pleasure to be here today with Dr. Ball and Dr. Russman. The Department of Community Resources and Services, Office on Aging and Independence, welcomes the opportunity to partner again with the Howard County Health Department and the Department of Fire and Rescue Services Mobile Integrated Community Health Team to assist with organizing COVID-19 vaccine booster clinics. Previously, we partnered together to deliver COVID-19 vaccination clinics for older adults and individuals living with disabilities across Howard County's independent living facilities and small assisted living homes. As a result of the strong collaboration across county agencies, Howard County was the second area agency on aging in the state of Maryland to complete a vaccine clinic at all independent living facilities, ensuring the safe vaccination of over 600 older adults, and contributed significantly to the high percentage of Howard County residents 65 and older who received vaccinations by mid-April 2021. Older adults, identified as one of the most at-risk populations for COVID-19, are a top priority for COVID-19 booster shots. We are pleased to be at the forefront of the booster clinic planning with our partners to ensure on-site vaccine clinics are available for residents at independent living facilities, small assisted living homes, and now 50-plus centers. Notably, these on-site clinics bring vaccine boosters to those who may experience difficulty scheduling a booster appointment, have a cognitive or physical impairment, transportation challenges, or even language barriers. We believe it is essential to take vaccine boosters into the community to ensure optimal access for Howard County older adults. I want to thank County Executive Ball and Dr. Rossman for their continued leadership throughout this pandemic. Through data-driven approaches, thoughtful planning, and collaboration across agencies, we have been able to ensure timely access to vaccine and soon-to-be booster shots. Thank you very much.
Thanks so much, Jenna. And now we'll take this as an opportunity to take questions from the press.
Okay, great, I got it all to myself. Okay.
Excellent.
I think so. I would like to ask Dr. Rossman or County Executive, I'm not sure, it's kind of a medical question. We know that the whole idea of booster shot came about because of Delta and the tracking breakthrough infections among the fully vaccinated, especially those who got their shots early. I'm wondering if Howard County has also noted breakthrough infections here, possibly among staff in the health department. You know, you got to vaccinate the vaccinators first, or medical workers and that sort of thing. If it's something you've noticed locally as well.
Absolutely. For the benefit of those who are tuning in on Facebook Live, I'm going to repeat that question. The question is, given that there have been breakthrough cases as well as an increase in the Delta variant and other variants, what is Howard County seeing locally as far as what's happening regarding transmission? And this is directed to Dr. Rossman.
So thank you for that question. One, I'd like to say that the concept of boosters has been discussed even in the development of these vaccines. So I don't think the discussion about boosters or even the need for boosters was solely raised by Delta. But certainly Delta is concerning, and we are seeing breakthrough cases within Howard County, as we are in Maryland, as we are across the United States. I've been yet to ascertain whether or not persons who are becoming infected despite being fully vaccinated, it's because they're 8 months, which would be the most at this point, versus 2 weeks post or even a month post. So I don't think we know enough about really the length of time, hence why the FDA and CDC and advisory committee are studying this. You may ask them, Dr. Rossman, what's the percentage? It fluctuates between 30 and 40% of our cases. The vast majority of our cases in the hospital are unvaccinated, and our mortality is among the unvaccinated. So again, these vaccines were designed to protect against severe illness, hospitalization, and mortality, and they're holding up against those. Which is obviously very, very important. So I encourage everyone who has not yet gotten their vaccine, get their vaccine. And when we find out more from the CDC and FDA and advisory committee on the boosters, we will be prepared to administer them.
And since you're here, if I may ask a question I get asked all the time, and I know you're ready to answer. What if the FDA's criteria for this currently eligible group differs from what my doctor tells me? Who do I go by? And how do I know if I'm in this immunocompromised group? Where's the line drawn?
So one, if you believe you may be eligible for the currently authorized third dose, you should talk to your doctor. And there are specific criteria that your doctor can assess whether or not you're eligible. If your doctor says that you're eligible and you came to Howard County Health Department, there would be a series of questions you would be asked. You check off yes, you are attesting to the fact that you have one of the conditions listed, and you get your vaccine.
Thank you.
You're welcome.
And I do have another question for the county executive.
Sure.
I'm wondering if, congratulations on the 70% of the population vaccinated. That's amazing. So I'm wondering if, despite that, are there any plans in the works to put in place any sort of vaccine requirement for county employees and/or incentive for county employees to get the vaccine?
Thank you for that question. This question is directed to County Executive Ball and really underscoring that while Howard County has more than 70% fully vaccinated, are there plans regarding mandatory vaccination of employees or incentives for county government employees?
Great question. So the team meets daily, and we evaluate the metrics as well as best practices. We're always focused on the goal, and the goal is to save people's lives and keep them healthy. And so when we evaluate the interventions, we evaluate them based upon our metrics and how they are accomplishing the goal. I think as we see other jurisdictions around the state and the nation, there are sometimes mixed results with various interventions. And so we are always evaluating what makes the most sense, whether it's testing or vaccine mandates or masking, and we're looking at the metrics. As the data come in, we see where are we and how can we exercise the interventions that will have the desired impact.
So is it fair to say you're considering it, but the metrics don't show you need to do it yet, or that it would be accomplished what you would hope it would?
So the question is, are we considering it, and is it that we haven't met a certain metric threshold? In Howard County, since the beginning of our first confirmed case of COVID-19, March 15th of 2020, we have always been willing to make the tough choices. But we're only willing to make the tough choices that make the most sense for our community. And we will continue to make those tough choices. And that means we will consider every and any intervention to save lives. As Dr. Rossman indicated, right now, what we're seeing in the mortality rate, it is among people who are unvaccinated. So the biggest and best way that we can help save lives is to ensure that people are vaccinated. Thank you.
Thank you, Dr. Ball. Are there any other questions from the press?
Okay, I'm gonna ask one more, I promise, last one.
Sure.
Along the same lines, Dr. Ball, are you talking about discussing any plans or making preparations when the vaccine's approved for younger kids to do in-school vaccinations? I know Howard County kids can get a flu shot in their school, so are you talking about that as well?
Okay, the question is, are there discussions that are happening right now regarding in-school vaccinations once a vaccine is approved for children under 12?
We anticipate that the next big push will be authorization for vaccine for our residents ages 5 to 11. And we are in active talks with our school system and our health department to ensure that vaccine distribution is as efficient and as quickly as possible. We want to make sure that not only is it available as it is, but that it's accessible and we break down any barriers, whether it's transportation or it's time. So we are excited for the prospect on the horizon of vaccine availability for our younger residents. And talking with many parents of the younger kids, they are understandably concerned. And I'm very pleased that the school system and our teachers union has been working together to ensure that there is not only increased testing, but vaccination for our educators who are going to be interacting with our young people.
So for regular people at home, is that a yes? You're hoping to provide those shots for kids in the schools when they're available, or is it a maybe?
So the question is more clarification on whether or not the shots will definitely be provided in schools. And as you know, the Board of Education, the school system, has a lot of the final say on much of school policy. But I know that Dr. Rossman and her team are in very active talks with the school system, and we are building the infrastructure. You know, this was week one of the kids coming back, and so I think everyone from transportation to all of the health challenges, the school system has been working and learning, and I think once there is authorization, we will continue to collaborate and hopefully move forward.
I think it's in the works.
We'll take that.
Okay, thank you so much.
Thank you. Any questions while I'm still up here? Any other questions?
No, thank you so much.
All right, thank you all so much for coming out and enjoy the rest of your day.